You are watching the DocTalk show.
Tuberculosis is an infection that is spread via the air. This means if someone is infected with TB and they cough, they will release the TB germs into the air. And if someone who does not have TB breathes in the same air, they can become infected with tuberculosis. So with me in the studio are experts Dr. Baluku Joseph and Dr. Phil Gothard, who are experts in the field of TB, and they're here to help us understand how exactly we can identify someone who has TB, how best we can help them in ensuring they get treated, and most importantly, how it can be prevented. So I'll start with Dr. Baluku. How exactly can someone know that they have developed TB? Since you know it's an airborne disease, you can't see the germs, how can they tell they have TB?
So maybe Darius, picking up from what Dr. Phil had discussed earlier, and I think it's important, is that so it's not only about coughing that somebody can spread out the germs, even through speaking, even through singing, even through talking, sneezing. So I usually tell my friends when I'm teaching about tuberculosis that if you suspect your pastor has TB, don't sit in the front row because he might as well spread the germs to you when he's preaching.
Okay, so it's not just coughing.
It's not only
What's most important is the bugs come in the air. So
coming out.
It's whether it is talking or sneezing or singing,
exactly.
We're still releasing the particles into the air.
Exactly. And then in Uganda, where sometimes the quality of milk is not excellent, and so if milk is infected with a certain type of bacteria of TB, so if you drink this milk, this TB can infect your intestinal system. It's not very common, but it occurs, especially if the milk is not very safe.
And this is the TB coming from animals?
Exactly, yeah, coming from animals.
And
then talking about how do I know that I have TB, or how can I suspect?
Yes, how does one tell? Because some diseases you can't really tell. Does one get like high fever like malaria and they say they have TB? How does it start?
So in many patients, they will have a cough, but a very good proportion of patients will be coughing. But on top of that, they will have a fever. This fever usually comes in the evenings. And then they can sweat a lot at night, so much that even the bed sheets get wet. Then they can lose weight, usually over a period of about 3 months or 6 months. And then their appetite becomes so low. That is the commonest.
That's the common.
So it is somebody will experience TB.
So a common presentation is the person will cough. Is it like a 1-day cough, 5 days?
So
What's a typical cough?
So the majority of patients will have cough for a long period of time, more than 2 weeks. But if somebody has HIV, then this cough may not even be 2 weeks. It can be as short as 2 days. So if somebody has HIV and has these fevers, probably the patient might have TB. And so it is important for them to be tested earlier than wait for 2 weeks of a cough that is not going on.
But here's the difficulty. These symptoms are quite general. People with pneumonia could present initially like this, people with a viral illness in their lungs, bronchitis, people with fever for other reasons. And so the difficulty is that how do you pick this uncommon condition from all the other common causes of fever and cough and weight loss, here in Uganda? And so often when patients present to see a doctor, they're treated for the common conditions first, and only over time, when they don't get better, does it become apparent that TB should be on the differential for what's causing that.
Okay, so that's another important point. If someone's cough is not responding to antibiotics, people take a lot of medicines, antibiotics of all kinds. So if the cough refuses to go, or it keeps coming and going back, despite taking medicines, that is one sign of tuberculosis, possible tuberculosis. Yeah. If someone thinks they have TB, they are coughing, they have the fevers, where should they go for help, Dr. Baluku?
So what happens in most of the hospitals in Uganda, at almost all our outpatient departments, whether it is at an antenatal care or dental clinics, usually in the public hospitals, there is somebody stationed there to screen for TB. For TB. He will have a small piece of paper and asks about 4 questions. Are you coughing? Do you sweat a lot at night? Have you lost appetite? Have you lost weight? And then if they find that you have a yes to any of these questions, then they will refer you to a doctor who will further do some tests. They may take an X-ray or a picture of your lungs, or they can ask you to cough up and produce some sputum, which they will go and examine in a machine to tell that you have TB or you do not have TB. So most of the time, that's what will happen.
And that's how TB is diagnosed.
And that's how, once they detect the bugs in the sputum, or they look at the X-ray and it does not look normal, your lungs look sick, then the doctor will make the decision to put you on treatment. But
is it, may I ask, yes. So these tests you're talking about, the X-rays, and they check in the sputum. Sputum is what comes out when someone coughs from the lungs. Are they available in all hospitals in Uganda?
So the majority of our hospitals in the country have at least a microscope that can look at the sputum to detect, including our health center tools. They can able to do a sputum diagnosis through checking through a microscope. The advanced hospitals have more sophisticated machines that can test, but by and large, if the doctor sees you at a health facility and highly suspects TB, the doctor will start you on treatment, and improvement is also a diagnostic test. Improving on treatment is also evidence that you had TB, and sometimes even when the doctor has not seen the bugs themselves, can make the decision to start you on treatment. And that is because TB is a very complicated disease. Sometimes somebody has the TB, has the signs of TB, but the bug they can't be seen. And so treatment sometimes is the diagnosis.
So Dr. Phil, when it comes to detecting TB, how fast can these tests, how fast can someone get the results?
No, that's a good question. Yes. I mean, so of course, lots of people who have symptoms of TB don't present to a hospital. They first present to a pharmacy, occasionally to a traditional healer. If they're up country, they'll present to Health Centre 2 or 3. And it may take time to be referred to hospital. And in some of these places, the diagnostic tests to find TB are just not available. But also the opportunities to treat TB are not there either. So it's really important that if you're not getting better, you do go to a public facility that's a reasonable size that has access to staff who understand TB and can do the tests. And if you go there, one of two things will happen. And we've got some good data in Uganda now on the diagnostic methods. About a third of patients with TB will have been diagnosed by a rapid cartridge or molecular test, which only takes a couple of hours, but because of the logistics, you can have the following day. Okay. And about 2/3 of patients in Uganda will be diagnosed, as Dr. Joseph said, on a microscopy test where a sample of sputum is looked at under the microscope and you see on staining the bugs for TB.
Okay, so most important is the patient will get the results preferably on the same day.
Ideally on the same day, but of course when you've got issues with capacity, it may mean having to come back the next day, and of course you lose people if they have to travel some distance for the result.
Yes, because someone is coming from deep in the village and they've come to the hospital. At least if there's access to some tests that can give a very, like the results will come out very fast, that means they'll be able to get the diagnosis and start treatment as soon as possible.
Exactly, and there's some very exciting initiatives here in Uganda using, for example, mobile phone technology to communicate these results.
Okay.
We can talk about that.
So again, you're watching the DocTalk show. We are discussing tuberculosis. So after the break, we shall come back to the golden question: is TB curable, and how can TB be prevented? As well as some additional facts you should know about tuberculosis. There are increasing concerns of what they call multi-drug resistance TB. So our experts in the studio help us understand this concept. Send in your questions and comments to our social media platforms, and our doctors will ably respond to each one of them.
You are watching the DocTalk show.